presentation here, and then we'll kind of just, if y'all have any questions at the end, feel free to ask. And kind of as we're working our way through here, if y'all have any questions, feel free to ask. And then I brought over some equipment here. That way, we can talk about that, and then we can, practice on some of this stuff if any of y'all want to try it. So I'll go ahead and get started here. All right, so this is kind of what we're going to talk about. So we're going to understand why improving your balance is important, and then kind of the 3 different body systems that go into our balance and how those systems interact. We're going to talk about the different types of balance, and then I'm going to kind of talk about the role of physical therapy and how we can help you improve your balance. So poor balance equals poor outcome. So, especially in our older population here, that being 65 and up, falls are more and more prevalent. And, as we age, we become more frail. And, these falls that we do have, lead to, bigger injuries, overall poorer outcomes than, someone who is younger. So, just a few stats here. So 25% of older adults fall every year, 20% leading to serious injury. So, there's any number of things can happen because of a fall. One of the main things we think of are hip fractures, or head injuries, falling, hitting your head on the concrete, or landing on your hip and breaking a hip. Those are probably the 2 more common injuries that we see. But additionally, you can break arms, wrists, if you're trying to catch yourself as you fall. So any number of things can happen due to falls. Also, falls result in a lot of healthcare costs go towards falls. So about 3 million ER visits, 800 hospitalizations, about $50 billion in medical costs. On top of that, falls are actually one of the leading causes of readmissions into hospitals, after you, discharge. So I also actually work in an inpatient rehab facility, and, a lot of people there are there because of falls. And falls are one of the, like I said, leading causes of people being readmitted after being discharged home. And so, a big goal is, fall prevention and trying to prevent falls from happening. Over here, this is kind of our vicious cycle we have here. So, we fall, and because of that, we now have a fear of falling. It has actually been shown that people who have a fear of falling are going to be more likely to fall, because you're gonna try your hardest not to fall. You're gonna move in certain ways that you would not typically if you did not have that fear of falling. Or you're just not gonna move as much. You're gonna stay more sedentary. You're gonna be inactive, and thus that's gonna lead to kind of weakness of all of our body systems. I know y'all heard the saying, you use it or you lose it. That is definitely very true, especially in the physical therapy field. A lot of patients think, oh, I'm gonna leave the hospital and I'm gonna go home and I'm gonna be able to do my normal things how I normally did them. Unfortunately, that's not really how it works. If you don't train your balance, you don't train your strength, you don't train your endurance, you're gonna fall behind and you're gonna lose some of that stuff. Okay, well, there we go. And then, obviously that's going to lead to an increased fall risk. So now talking about kind of the balance systems, or the different systems that play into our balance. We have our vision, we have our somatosensory system, and then we have our vestibular system. So vision, obviously everyone knows what that is, being able to see, being able to kind of perceive the world around you. We actually heavily rely on our balance from our vision, probably more so than any of these other 2 systems here. I don't know if any of y'all have ever tried, if you're getting up in the middle of the night trying to walk around, it's a lot harder to get around than it is, during the day or when you have lights on. And a lot of times that can be what leads to falls is, we wake up in the middle of the night, we gotta try to rush to the restroom, we fall, we slip on a rug, if we have a walker, we catch our walker on the door, or on the bed, and that can lead to falls. and kind of under each of these systems just kind of talks about, you know, as we age, we're going to kind of lose a little bit of these things. So visual acuity, meaning just your ability to see, that's going to decrease as we age. Your somatosensory system. So your somatosensory system is basically just your body's ability to kind of perceive where it is in space. So again, you know, the way that I think about this, if you close your eyes and you're kind of, you know, reaching for certain, like if you know where your light switch is on the wall, you can probably close your eyes and you're able to kind of reach for where that's at. You know, even though you can't see your arm, you're still able to touch the wall, you're able to find what you're looking for. And so whenever we talk about somatosensory system, we're just thinking of your senses, being able to perceive touch, being able to perceive what we call proprioception, or basically again is, you know, being able to perceive where your limbs are in space. You know, additionally vibration, it talks about here. And then our vestibular system, that is kind of our inner ear. So our inner ear is made up of these canals that has these kind of different, you know, fluids running through them, which basically allows us to maintain our balance even when we're kind of altering our position. So, you know, rolling over in bed, say we're laying down, we stand up. If those vestibular systems aren't working correctly, then you'll notice you'll get a lot of dizziness and lightheadedness whenever you kind of change positions. I don't know if, you know, any of you have ever been laying down, you sat up too quickly, you got dizzy. So that's kind of, you know, that vestibular system working there. Or in addition, maybe you were, you know, laying down in one position for a long time, you roll over in bed, you feel like the room starts spinning. So that, you know, indicates that maybe you have some sort of dysfunction in your vestibular system in your inner ear. And then VOR, that's our vestibular ocular reflex. So what that is, you know, being able to kind of perceive head movements and kind of follow those with your eyes. So basically, you know, even if you tilt your head, you know, your vision's not going to go all sideways. You can kind of still see what you're doing even if you tilt your head, you know, certain directions. Again, as we age, we're going to kind of lose some of that ability. All three of these systems, you know, must work together to maintain balance. If one of these systems is a little bit, you know, deficient, then our other systems will try to make up. We'll try to make up for that. But you know, it's not going to be able to fully make up for that deficiency in one of those systems. So these are like the three main balance systems. I also like talking about the musculoskeletal system because that's, you know, that's our jam as physical therapists. You know, we're all about, you know, picking up heavy stuff, putting it down, you know, improving our endurance. You know, so if we don't have good strength or don't have good endurance, those can lead to falls as well. You know, maybe you're not falling because you lose your balance. Maybe you're falling because, you know, you're walking around, you don't have very good endurance, and you need somewhere to sit, but you don't have anywhere to sit. Your legs give out on you. So, you know, I like at least kind of mentioning the musculoskeletal system as well. And again, you know, strength, endurance, range of motion, flexibility. You know, as we age, we start adopting different movement strategies, which can lead to tension and tightness in certain muscles. And so we kind of lose our flexibility and lose our ability to be able to adjust if we kind of, you know, step off a curb where we need to catch ourselves, is one way that I think about it. So additionally, kind of slower reaction time here too. We'll kind of talk about that a little bit when I talk about the types of balance here. So your types of balance. So the main two types of balance are going to be the static and dynamic balance. This anticipatory and reactive balance, they're kind of offsets of your dynamic balance. So our static balance is, you know, just like it sounds, being able to stand still and maintain your position. So say you're, you know, doing the dishes, you're standing at the sink, you have to be able to stand, you know, you have to be able to maintain your balance to do those certain tasks. Or, you know, say you're, you know, out with your family, you don't have somewhere to sit, you're standing up for a long period. You know, static balance, you know, it's not going to be as important as dynamic balance just because, you know, our dynamic balance is what we typically think of, but you have to be able to have good static balance to have good dynamic balance. So your dynamic balance is balance with motion. So, you know, any tasks that we do in our day-to-day life requires dynamic balance. So whether it's walking, whether it's transfers, being able to get out of the bed and get up into your chair, being able to, being able to do stairs, you have to be able to maintain your balance when you're doing those things. Talking about your anticipatory balance, so again, this is kind of an offset of your dynamic balance. That is being able to maintain your balance whenever you're performing something that is expected. So, if you're reaching up into a high shelf or you're picking up something off the floor, stepping over an object, you're prepared to do those things, but you still have to be able to do those things while maintaining your balance. Whereas the reactive balance, that's kind of more of an unexpected outcome. So, I wrote slipping off a curb here, stepping in a hole. So that's, you're not prepared to do those things. You're not gonna intentionally slip off a curb, but it does happen. So you have to be able to, catch yourself, kind of prevent falling. And then, I wrote catching something as well. It could be things of varying weight. Basically, your reactive balance is being able to maintain your balance when there's a sudden kind of perturbation or force that kind of pushes you in a different direction. And we can train all of these things. We can and we do train all of these things through physical therapy. And I will talk about that a little bit now. So why physical therapy? So first off, we can assess your fall risk. There's a lot of different outcome measures that we use. Talking about a little bit of a couple of them here, we have our tug test, which is basically it's a timed up and go. So we have you sit in a chair, we have you stand up, walk 10 feet, turn around, and sit back in the chair. So what that's doing is assessing your gait speed or how fast you walk, because we have seen correlations between how fast an individual is able to walk and their risk of falls. So obviously, if you're more prone to falls or you have a fear of falling, you're going to try to be very steady, and you're probably going to walk a little bit slower than someone who isn't as fearful of falling or isn't as big of a fall risk. We also have our Berg test, which is the Berg test is really good because it's very functional. There's a lot of different kind of tasks that it looks at. It looks at your balance in sitting. It looks at your balance in standing. It looks at your balance kind of with transfers, so standing up from a chair, getting onto the bed, being able to turn and look over your shoulder, being able to step up onto a step. So it's very functional. And with physical therapy, we try to make things as relevant to you as possible. So if you have problems with falling during transfers, we're going to work on your balance during transfers because that's how it's going to equate most to you. Additionally, so our FGA, that's a functional gait index, so maybe you have more balance issues whenever you're walking. So it looks at, various different factors of gait. So, basically having you walk normally, having you walk fast and slow down, having you, do turns, having you step over objects. So that's a kind of a way that we can look at your gait and if that's possibly a reason why you're falling. And then we have this is our mod cat sit here. So that's where we kind of use one of these pads right here. And so talking back about our somatosensory system, that's our ability to be able to sense where our body is in space. If we stand on something like this AirX pad, it's going to be a lot more difficult than just standing on the hard surface of the floor. So, I don't know if any of you have ever heard of neuropathy. So that's, a lot of times it happens in our feet just because that's the farthest, the most distal part of our body. And if we can't feel our feet, it's going to be very hard for us to maintain our balance, especially if we're standing on something like this. So, our mod cat sit, we have you stand on the regular surface, we have you stand on a regular surface like this, we have you close your eyes while you do it, that way we take our vision out of it, because like I was saying, we rely on our vision a lot for balance. So, if we close our eyes and we're having a lot of trouble balancing, it could be that, either our vestibular system or our somatosensory system maybe is deficient, and our vision is trying to make up for a lot of that deficiency. And then our assistive devices. So I saw Mr. Roy here. He had a cane there. We will watch you walk with those things. If you're not using an assistive device, but we do some of these tests and we feel like you're a fall risk, we're going to suggest some of those things. And we can teach, if you've never used them before, we can teach you how to use them correctly. Because again, the big goal is preventing falls, because falls, again, lead to poor outcomes. We also, look at your strength, we look at your gait. So, like I was saying earlier, because of, decreased range of motion or flexibility or strength in some of our muscles, we adopt different movement strategies, and that could lead us to be more prone to falling. So we look at your gait, and, we teach you how to walk normally, I guess, per se. And, if based on your gait, we see that, there's some muscles that need strengthening, we can help you, strengthen those muscles, obviously, as well. And we have tools to challenge all of these systems. So like for our vision and our vestibular system, has anyone ever heard of BPPV before? So that's called benign positional basically it's vertigo is what it is. And so, yeah, it's vertigo. And so, and it's the most common form of vertigo. And so, speaking of your inner ear, like I was talking about earlier, and that fluid kind of going around in your inner ear, some of those canals in there become, we have these crystals that get stuck in those canals, and there's different maneuvers that we can do to basically get those crystals unstuck. And then, if that is where your problem is coming from, something as simple as doing those maneuvers a couple times could really, decrease your dizziness and improve your balance. We also have gaze stabilization exercises, so there's different exercises that we can do if you're having like more problems whenever you're walking and turning your head, or you're rolling over in bed. There's different exercises that we can do to be able to improve your gaze stabilization. For your somatosensory system, kind of like I was telling you, we have different things like these foam pads here that we use that are going to challenge that somatosensory system. Also, we'll have you close your eyes and do stuff, because that's going to make it more challenging. Unfortunately, to challenge our balance, we have to feel like we're a little bit off balance. If you're just standing on the firm surface of the ground, completely steady, you're not really going to be working your balance. And so, kind of on the next page here, I'll show you one of our suspension systems that we have to make you feel more safe as we're doing some of these balance exercises. And then again, we're gonna strengthen the heck out of you. We're gonna strengthen the muscles that are weak. We're gonna stretch the muscles that are tight. So that's just basically a core principle of physical therapy. If you have weak muscles, we're gonna strengthen them. If you have tight muscles, we're gonna stretch them, because all those things play into your balance as well. So here is kind of that suspension system I was telling you about. So we have these harnesses that we hook you up to, and then there's kind of a rope coming from the ceiling, and we attach you to that rope with a carabiner, and that will allow you to, feel safe whenever you're doing these balance exercises. Even if you lose your balance and fall over, that suspension system is going to hold you up. And then additionally, all physical therapists are trained to be able to guard people when they're doing these exercises. So that's two different factors there. You got your physical therapist and the suspension system that's going to be making sure that you don't fall, obviously. And then over here to the right is our body track. And so kind of that mod cat sib I was telling y'all about, where we have you stand on the ground, on the firm surface, we have you stand on the pad, eyes open, eyes closed. We can do that test with this body track system, and that will be, it's basically a pressure mapping system. So if you look here and you see kind of the red, yellow, green, that's basically the pressure coming from this person's feet. And so we can see maybe there's certain ways that or directions that you lose your balance whenever standing on surfaces like this, whenever closing your eyes. And that will be able to give us kind of objective view of, your balance, and your kind of, are you able to keep your center of gravity over the middle of your body there. I personally use this SOS system a lot. it allows you to do more advanced kind of balance exercises while still making the patient feel safe. Over at Fyzical, we have 2 ropes coming down. So one of them we use to basically, we have a little handle that people can hold on to, because the goal would be able to walk without needing that upper extremity support. But if you're not always going to have that good of balance right starting out. So if you really do need something to hold on to, we have something you can hold on to. And then we have you do different tasks. Like this guy's stepping over hurdles. I brought a hurdle here as well. I use these a lot. I do forward step overs, I do side step overs. Additionally, we have kind of this RX beam here. And this, I use a lot as well to do tandem walking, which is basically kind of your heel to toe walking. It narrows your base of support, and which makes it more challenging on you. It's going to be a lot harder for you to stand with your feet together than it would be with your feet kind of farther apart. So these are just a couple of the tools that we can provide you through physical therapy, on top of the obvious strengthening type stuff and stretching exercises that we're going to do, and endurance type exercises as well. And then I did pass out one of these little flyers to y'all. So if you look on this page, it's going to kind of talk a little bit about kind of those balance systems I was telling you about. So, one, it's talking about exercises to improve your strength and balance. Again, maybe you're falling because you're not strong enough and your legs give out on you. Number 2 there, it's talking about getting annual eye checkups, because remember, like I said, we heavily rely on our vision for balance. So, if you need to be wearing glasses or you need to be wearing contacts, make sure you're doing those things. And then 3 here, it's kind of talking about, ask your pharmacist about your medications, because a lot of times, as we age, we take more and more medicines. Some of those medicines can kind of lead to dizziness and lightheadedness. And the main one that I think of is what I call postural hypotension. So hypertension is high blood pressure. So a lot of us have high blood pressure. We take medicines to lower our blood pressure. Maybe those medicines are decreasing your blood pressure too much and leading to low blood pressure. That could, cause dizziness and lightheadedness. So, just make sure you're keeping up with your medicines. You know what the purpose of them is for, and talk to your pharmacist or your physician about those things. And then number 4 here, it's just talking about making your home safer. So the main thing I think of is rugs and like little pets, like small dogs, small cats. Those are, we love them, but they can be trip hazards. So make sure. I'm not telling you to get rid of your animals, obviously, but make sure you know where they are. And additionally, if you need help with certain things, like getting on and off of the toilet, getting in the shower, make sure you put shower chairs, shower benches, rails up, stuff like that to make you safer whenever you're doing those things. And then basically the last one's talking about our lighting. So again, just it's going to be harder to balance yourself in the dark than it is with the lights on. So make sure if you don't, beside your bed, if you don't have a light switch there that you can turn on, maybe you at least have a night light or a flashlight or something that you can use to get you to the light switch. All right. So does anyone have any questions for me? Yes, sir.
I make it a point to actually do things in a little bit more stressful way in order to keep balance. I don't know if that's good enough. For example, sitting here like I am, I normally will try to stand up without using my hands.
Yeah.
Same thing on the toilet.
Mm-hmm.
When I'm done, I try to not push off with my hands, and as long, for the most part, I can still do that.
Yeah, no, that's good, because like I said, you're not going to work your balance if you're not challenging it. The only thing, for you, it seems like you're able to do those things fine. The only thing I would say, cautioning people trying to do those things if they are too challenging, because at physical therapy, we're not always going to, we like providing you exercises you can do at home, but we're not always gonna, we're really never gonna provide you exercises that are really gonna challenge your balance at home, because we want you to do those things when you're coming to see us so that we know you're safe. If you have you know, someone at home with you that can kind of watch you and guard you when you're doing those things, that would be great. But you just, you know, need to be cautious of doing these like higher level balance exercises that we do in physical therapy when you're at home by yourself.
So that means I have to put a 2-beer limit on doing this.
Yeah. Yes, sir. Yes, sir. All right. Anyone else? Any questions I can answer for you? If not, I mean, we can try some of this stuff out here as well.
I do have a question.
Yes, sir.
It always comes to money, it seems like, but if Dr. Imperial refers us to you, would Medicare pick that up or would it not?
Yes, sir. Yes, we do. Yeah, Medicare will cover your physical therapy, and I mean, usually it's up to, you know, like they'll cover you for however many visits, or Philly might be able to speak a little bit more about that.
So Medicare has like a soft, like it says up to $2,330 right now. There's, you'll be able to be seen for therapy. But beyond that, if you still need therapy, what would happen is, for example, the physical therapist would put in something called a KX modifier, saying that the treatment is justified and it's medically necessary. So the honest answer is that there's really, like if you're traditional Medicare, if you have traditional Medicare, you can have as much physical therapy as is medically necessary. Yes, it has to be justified beyond that 2330. So yeah, that would be a short answer.
Like Billy was saying, as long as we can show, one, that you're making progress with us, which is why we use those certain outcome measures I was telling you, that tug test, the bird test, those give us objective measures that we can test when you first come in, and then we can retest later to say, hey, look, they are getting better at these things. So as long as we can show that you're making progress, but also that, like Billy was saying, there is a medical necessity for the physical therapy, then usually, they will give us more visits for you.
So are you saying?
Yes, ma'am.
I noticed that going up steps, one side seems weaker than the other. Is that common?
There could be any number of things. Like, typically when I think of one side being weaker, I think of patients who are like post-stroke, because normally strokes, affect one side of the body. But I mean, maybe it's just, do you have a dominant leg? Is there?
I do. I have a preference.
So it could just be you're using that side.
Stepping on the curb, it will be with one side rather than the other.
Yeah, and it could just be that you subconsciously you always use that side whenever you're doing those tasks, so that side is just going to be stronger and you're going to favor it. So what I would say is, I would challenge you to try using the other side. Obviously, if you don't feel safe doing it because of balance issues or whatever, then don't. But through physical therapy, we can strengthen that other side, and we can teach you exercises you can do at home as well to strengthen that other side that's weaker. Yes, sir.
I don't have it. I hope I don't have it, but I've got two good friends who have neuropathy, and when they stand up or walk, both feet go to sleep. And one of them fell down and tore his ear off. And another one, he knows he has it, so he lives on a farm and he goes everywhere on a cart because he can't walk. If he walks, his feet go to sleep.
Yeah.
Can anything be done about people that have that degree of neuropathy?
So what I would say is, you're not going to like get rid of that sort of thing with physical therapy, but what we can do is we can teach you strategies to be safer whenever you are being mobile. Or, we can strengthen up your legs, we can, again, stretch the tight muscles you have, improve your endurance, and we can improve those other balance systems to hopefully kind of compensate a little bit for the neuropathy that you're having in your feet. Yes, ma'am.
Would there be possible to have Dr. Imperial recommend an evaluation at some of our advanced years? I had issues about 3 years ago and ended up going to the chiropractor and was pleasantly surprised when Medicare picked up a good deal of those payments.
Yeah, I mean, that's how we get our patients, is we have referrals from their doctors.
Just to see how
Yeah,
much
yeah,
they may or
exactly.
may not.
Exactly, and you know, there is bound to be something that we can work on with you,
Mhm.
whether it's balance, you know, there's, you know, people have different levels of balance, you know, so we can always work on that, you know, you can always, again, work on the weak muscles, the endurance, you know, making sure you have the stamina to be able to, you know, go and walk around the grocery store, you know, walk around town and shop, stuff like that. There's very rarely ever a time where a patient comes in and we're like, oh, there's nothing that we can do to help you. So there's bound to be something that we can do to help you out. And as long, like Philly was saying, as long as we can justify that, then, you know, your insurance will pay for those services.
Mhm.
Yes, ma'am.
Would you say that, say, at 70, or if you don't know whether or not you definitely have balance problems, or would you say that coming in when you're 70 or so to just be tested to see what areas you may be weak in and work on, is that something the doctor then would prescribe or recommend so that you can find out?
Yeah, I mean, if you feel like, you know, you might not necessarily know, but you feel like maybe you're not as steady on your feet as you were before, then yeah. Like I was saying, you know, the worst that can happen is you come in and we're like, wow, there's nothing that you can work on, you're doing great, but you know, that typically doesn't happen. Normally we can find something that we can do, even whether it's just like education on, you know, exercises you can do at home, or, you know, ways that you can move safer, or even just kind of, you know, talk about some of the stuff that I talked about here, so you're at least more cognizant and aware of those things.
And typically what Medicare will want is there's some sort of diagnosis.
Mhm.
So they're gonna assign everything to a diagnosis. And I would think with a referral, they're gonna need a face-to-face,
Okay.
like a visit, and then we decide you have some weakness, or, you know, one side is weaker than the other, any kind of diagnosis that could increase that risk of falling, and then we can set up that referral. So.
Yes, ma'am.
I think our first clue to ourselves is, or to me anyway, is I noticed I'm starting to walk like a penguin. And that was what my mother's cousin was doing. And so when I realized I was walking like her, then I realized I have a problem.
Yeah.
And so, you know,
Yeah,
I'm doing
that's
better.
a pretty common like gait pattern, and
Yeah,
that basically is just whenever a physical therapist sees that, they're like, oh yeah, they have weakness in their hips, because the way that you're moving, it's those muscles in your hips back here that are
Yeah.
attaching to the side are weak, and so that you're having to kind of swing your leg around to kind of make up for some of that.
Yeah, or toddling back and
Yeah.
forth from one side, literally like a penguin. It was awful.
Yeah,
To
that is
realize
common.
Yeah. Okay.
Yes, ma'am.
If someone comes in and they have back problems,
Mhm.
do you evaluate those to be sure you don't aggravate them or something in your exercises and so forth?
So typically how it works is, you know, when you're setting up a referral for physical therapy, so at like Fyzical, for instance, you know, you would talk to Philly, or who's ever worked in the front desk, and you'd say, hey, I have balance problems. And if that's the main reason you're coming in, when they set up that evaluation, it's going to be under balance. But at the same time, you know, the therapist is going to take you in, and the first thing they're going to do is they're going to let you kind of give your spiel about, okay, why have you come to see us? And, you know, you can always throw in, hey, you know, I've had back surgeries, or I have back pain in the past, and, you know, that way they're more aware of that stuff, and, you know, there may be, you know, different tests that they do to kind of make sure that's not going to affect you through your physical therapy. Or, you know, if it is, you know, they can work on flexibility of your spine, strengthening up some of your core muscles. You know, I pretty much do, you know, core strengthening stuff with all my patients, because pretty much everyone has weak cores, and they could benefit from improving their strength and stability of their spine. Anyone else?
Well, I think as we go older, I know, you know, I was very athletic as a young person.
Mhm.
I realize I don't have
sounds good.
keep my legs stronger, but, I have had a cyst on the back of my right knee, and it has made it very painful. Like my husband was saying, you know, he stands up without assistance, but it was so painful that I couldn't do that. I think I've managed to diagnose what was causing it, and it seems to feel better now. But the strength of getting up on that table was, I didn't have as much in my legs
Right.
as I did.
Yeah.
So,
I mean, like I was saying, obviously, strength, endurance, balance, all that stuff is gonna decline as we age, but, through physical therapy, we can still make improvements. It's not like, oh, just because you're getting older, you just have to be weak and you have to not have good balance. Like, we can still challenge those things and make improvements. So, and also a big part of it is the education part of it. We're gonna teach you how to, things to look out for, whether it's the dog or the rug or, whatever, how to use your assisted devices, ways that you can kind of, compensate for some of that decline.
And how to not stand up on an end table when
I've been over here biting my tongue.
Is the balance, a lot of the balance, is it a function of strength?
Well, it's all three of those systems like I was talking about playing into each other. So, any of those systems could be deficient, which could lead to loss of balance. So maybe it is your strength. Maybe, maybe your legs are just weak and, when you're up and you're walking around or you're doing transfers, from the chair to the bed, your legs just aren't strong enough to push you up or hold you up, and then they kind of give way on you. But it also could be the endurance. Maybe, you get, as you're walking around the grocery store, you're walking around, church or wherever, your endurance and your cardiovascular system kind of isn't, where it should be, and that leads to falls because your legs kind of give out on you. So it's kind of all those things playing together.
My wife and I belong to a group of people who are 55 and older, and we're doing exercises. And one of the things that these young girls always have us do is this airplane thing, where you stand on one leg and put your arms out and put your, bend over. Well, they're in their 20s and they can stand there all day like that. And I can stand maybe 2 seconds without getting off balance. And I'm just shocked at how I don't have the balance I used to have,
Yeah, like I was saying earlier, your vision, your somatosensory system, your vestibular, all of that kind of declines as we age. But that's why we teach you strategies to be safer. Like I said, there's still improvements to be made. Like the standing on one leg, that's stuff that I do in physical therapy all the time. You have to be able to stand on one leg when you walk, right? So we make things functional for you. We're gonna have a reason for whatever we're asking you to do. Maybe I don't know about the airplane type thing, but
it's amusing to look around the room.
I bet it is.
There's about 15 of us in this group. We all look around and everybody is, it's this airplane deal, They're falling over, they're getting, everybody is jumbling except these two young girls that lead us, and they're steady as a rock.
That should be your goal. To get to that.
I can't get 21 again.
I know I do practice when I put my pants on to not hold on to anything and to stand on one leg while I'm putting the other leg in the pant leg. And that, I feel, works on my balance.
Yeah, it does. Yeah, like I was saying earlier, if you feel like it's challenging for you to do those things, then you're going to be working on it. Like, it's going to improve your balance. But just sitting down when you're doing those things, you're not working on your balance as much. So, you know, making those tasks, you know, especially, you know, kind of in the inpatient setting too, just because I am in kind of both settings, and so, you know, that's a big part of the inpatient setting is practicing those functional tasks, practicing being able to get off the bed, get on the toilet, put your clothes on, get in a car, you know, walk. You know, we have to be able to do those things safely before we can do this more advanced stuff.
If you're saying neuropathy, there's not anything that you can do. I mean, I have it in my toes, but, you know, the rest seems to be okay of my foot. But
Yeah.
it does make a difference.
Yeah, it does. Yeah, I mean, that goes back in kind of into that somatosensory system. It's going to be harder for you to balance if you can't tell where your body is in space. But like I said, you know, we can make up for that by strengthening up your other, you know, the rest of your legs, strengthening up your core. You know, we can still work on your, you know, we can work on your other balance systems. We use stuff like these pads here to challenge that somatosensory system as well. Does anyone want to try any of these things?
We should.
We got our foam pads here.
Why don't you give a demonstration with the
Yeah.
handlebar thing?
Yeah. So basically, typically what I'll do with the hurdles, we have our suspension system that's, I believe it's about 25 feet. So I'll hook the patient up into the harness. We'll, you know, hook them up to the suspension system, and then I'll probably set out like 5 or 6 of these hurdles. You know, we're doing things like forward step overs with both feet. That's also practicing your walking as well. You know, what was your name, ma'am?
Marcia.
Like Miss Marcia, you know, practicing actually picking up your feet and doing a good heel to toe instead of kind of, you know, swinging our feet around.
Yeah.
You know, I'll also do things like side step overs, like that, and then, you know, we can make little obstacle courses out of it too. Maybe I'll set up a hurdle, and then after that, I'll set up one of these pads, and then after that, I'll set up something like a cone.
Okay.
So then we're practicing our good step over, and then we're stepping up onto the pad, and working on that somatosensory system, and then maybe we're doing some sort of like 360-degree turns, because, you know, sometimes we have balance impairments whenever, you know, we're turning, you know, or have that different head movements. So there's any number of things you can do. You know, we also like to make it fun. Sometimes over at Fyzical, we have a cornhole board. So, you know, that's a game, but it also can challenge our balance. You know, maybe while you're playing cornhole, I'll have you stand on something like this pad and throw. That's going to make it more challenging for you. Also, you know, one thing we like doing is we have these pickleball paddles and we have a balloon. We have you, you know, hit the balloon back and forth with us or one of our techs that's working on that reactive balance, because you don't know exactly where the balloon's going to go. You're having to adjust based on where it's hit. And then, you know, I'll also put one of this Eric's beam out here. And then usually what I'll do with this is kind of our tandem walking, which is just basically the heel to toe walking. So that's going to make it more challenging because it narrows your base of support. And again, it's going to be much harder for you to balance if your feet are really close together versus if they're really far apart. You know, we can also do like side steps on this thing as well. So, you know, we have a bunch of different tools that we can use to work on whatever sort of things you need to in regards to your balance.
So playing ping pong would help with hand-eye coordination.
Yeah, it would help your hand-eye coordination. It would help your balance too. But again, you know, if you have pretty good balance and you're doing those things and you don't feel like it's challenging for you, then it probably isn't working your balance. So there's, you know, that's why I said like with the cornhole, maybe we would stand on something like this pad here to make it a little bit more challenging for you. Anyone else?
So you can figure all of this out, like as in one, if you had an see, it makes logical sense to me, because I do have scoliosis. I have had vertigo bouts. I'm a tense person all the time because the whole world will not do what I want it to do when I want it to do it.
Yeah.
So that causes me stress. And and then that I think messes with my balance. So you
Yeah.
can some exercise plan then with like an evaluation.
Yeah, I mean, like I said, on the evaluation, we're gonna, you know, there's gonna be something that we can find that we can work on you with. You know, and as we're, you know, as you come and we're, you know, going through, you know, our sessions, if there's something else that we see that you have have a challenge with, then, you know, we'll work on those things too. We want, like I said, we wanna make it as functional for you as possible.
Seems like it's money well spent. So
Yeah, yeah, no, I mean,
I'll be checking with my doctor.
yeah.
Getting that done.
I'll have my people contact you. And you know, also these flyers here on the other side, they kind of have some different questions and I believe some different tasks that it basically, you know, asks you like if you're confident doing these certain things. And so, you know, that will give you a little bit more of an idea because, you know, sometimes you come in and you're just like, you know, I don't know why I have bad balance. And that's why as physical therapists, we know to ask certain questions to kind of prompt you. You know, we say, oh, well, you know, when do you normally fall? Do you fall getting out of the bed? Do you fall, you know, just walking? If you're walking on the grass, you know, you can't think about that stuff a lot of times. So that's why we're trained to ask you prompted questions.
Well, one of these is, the last one down on the right is blank. You probably ought to put the stuff about the 2-beer limit in there.
Yeah. Have you been drinking this evening?
Oh,
That's a good one. Yes,
Jill mentioned she,
excuse me, go ahead.
I was just gonna say, she mentioned she had numbness in her toes. I've discovered I have some numbness in my toes. And I haven't noticed that it affects anything yet, but I'm guessing that stuff like that gets worse.
Yeah, and you know, that would just, you know, that would also just be something you bring up to your physician as well, is to make sure that they're aware of those things, because maybe there's, you know, medications or something that they can do to help you kind of slow that process a little bit.
You briefly touched on stretching, the importance of it.
So, yeah, you know, so as we age, we adopt these different postures. You know, the main thing that I see in our older individuals is when they're walking, they'll kind of give this forward trunk lean, because that kind of offsets their center of gravity a little bit and it makes them feel more secure. You know, we'll also see they'll have a little bit of bend in their knees and they're not able to achieve kind of like that full extension. And that's going to lead to kind of tight muscles in your hamstrings, tight muscles in your hips, and all those things can affect your balance as well, because, you know, you may not be able to, like, say you accidentally step off a curb. You might not have the flexibility to actually be able to get your leg out to catch yourself because those muscles are so tight in your hips and kind of the back of your legs there. So, you know, it all plays together. We don't just look at, when you come to physical therapy, we don't just look at one thing. We kind of treat all of it.
I think you're gonna see her.
Yeah. Look forward to it.
This makes sense.
Yeah.
Well, thank you.
Thank you very much.
So yeah, and I'm sure, again, Fyzical is just across the street right there.
Oh,
So I'm sure
even
Philip wouldn't mind if you guys
Just
just stopped in
stone's
just
throw
to
away.
look at it.
Yeah, perfect.
And then we can talk if we ever needed a